In today's lecture, we will discuss about fluoride introduction and mechanism of fluoride. India, being a developing country where maximum of its population staying in rural areas, it's really this dental caries has developed a tremendous effect among the people in these areas. So the availability of fluorides and the consumption of fluorides, which is easily available on the many of the food, vegetables and fruits, makes it a benefit for those people to develop the dental caries. Why we need fluoride? The fluoride, which is a Latin word which means to flow, plays a vital role in inhibiting the development of dental caries. Coming to its chemistry, the word, it's a Latin word which means to flow. Its atomic number is 9 and its atomic mass is weight. It's 17 in the order of abundance. It is a group of halogen membrane. It's the most electronegative element because it can react with any other element. Coming to its history, Frederick Mackay, when he was studying his graduation in the year 1901, he noticed the few cases of stained enamel in his locality. That time when he completed his graduation, there were few cases. He opened his notes and there he found that there was nothing which has mentioned about this stains. So he reported this minute flecks or yellow brown spots scattered irregularly, and he defined them as minute yellow flecks or brown spots or areas scattered irregularly or streaked over the surface of the tooth, or it may be a condition where the entire tooth of the dead paper white-like appearance. So he moved to in 1908 he moved for doing his post-graduation. In the State Dental Association, Boulder represented his case, but there were not much thing he can make it out. So finally, he met the Dr. G.V. Black, in the dean, who was the dean of Northwestern University of Dental School in Chicago. The purpose was that he need help to recognize dental research workers and needed to define the exact geographical areas. He took some few cases to him. After that, even Dr. G.V. Black also searched him. He didn't find anything regarding those stains. So he agreed to attend the dental association, and before the meeting, he has mapped out the endemic area where the mottled enamel cases, and he found that it was around 87.5% prevalence rate were there was having the mottled enamel. Then after this findings that G.V. Black published in paper, and on that paper he find out that the published title was an endemic imperfection of the enamel of the teeth, herefrom unknown in the literature of dentistry. This in 1912, this article of James Figure in the Residents of the Naples, where he elaborated and named as a dentice. This Frederick Mackay and G.V. Black conducted studies in 26 different communities in various parts of the USA and concluded that there was something unidentified factor which is responsible for causing this mottled enamel. They established their assumptions when they came across the similar enamel mottling in the residents of Britain and found that the water source changed from shallow to deep wells in 1898. Prior to 1898, no mottling was seen, and the Bonn after 1898 had mottling of the enamel. They assumed that there is something in the water that was responsible for this. Similar results were studied in the bauxite in year 1909. They changed their water supply from shallow wells to deep wells and found cases were having mottled enamel. In 1931, the Churchill HV, the chemist who is from the Pennsylvania, found that the concentration of fluoride in the water was 13.7 ppm. ppm is part per million. And from this conclusion, from this result, they concluded that the presence of excess fluoride in the water is responsible for causing these stains. And when he was in Colorado, he named them as a Colorado stains. Shoe leather survey was another achievement in the field of science that Dr. Trendley Dean has done survey on 22 cities in the 10 states of USA among 5,824 children. He reported that there is direct relationship between high concentration of fluoride in drinking water. The fluoride enamel mottling was widespread in the areas with the water of a concentration of 3 ppm. Mottling with discrete pitting of the enamel was noticed. Fluoride levels of 4 ppm. Mottling was less when there is a fluoride concentration of water is around 2 to 3 ppm. No mottling result where the fluoride concentration was 1 parts per million. In 1934, he gave the index, that is Rinse fluorescence index, for recognizing the dental fluorescence, and further modification he gave in year 1942. There were some pioneer studies which we will discuss in our systemic fluoride classes. They were Grand Rapids, Newsburg, Kingston study. We'll discuss this in our systemic fluoride lecture. Now coming to our distribution of fluoride. So fluoride is distributed in environment, in hydrosphere, lithosphere and in atmosphere. Well, in environment there is high fluoride concentration in volcano eruption, soils, rain deposition, dust, snow, etc. Phosphate fertilizers, phosphoric acids and manufacturing of glass, ceramic and bricks. Fluoride in atmosphere, it is soluble fluoride found in air. Samples of 0.16 milligram per meter cube. Highest in cryolite, phosphate fertilizers, fluorinated hydrocarbons, plastics, uranium and other heavy metals. Various sources are there. Again, you can see water is a very good source for fluoride. Green leafy vegetables, fish, the salmon fish is very good source for fluoride. Then there are oranges, lemon, everything. Rock salt is again a good source of fluoride. The consumption of this green leafy vegetables, fluoridated water, and salmon fish can reduce dental caries if the proper concentration is maintained. Others include the vitamin supplements like you can take chlorhexidine, Listerine, mouthwashes containing dentrifices, anesthetic solution, organic filters, fluoride tablets can be taken, or fluoridated corticosteroids can be taken for as a source of fluoride. There are methods of fluoride analysis as can be done in calorimetric and acetate buffer using diffusion technique. Coming to the most important, again it is a long note and viva question, mechanism of action of fluorides. First is increased enamel resistance or reduction in enamel solubility. What happens? Our enamel is mostly composed of calcium, and when this fluoride comes in contact with it, it forms a calcium fluoride. Now this calcium fluoride, calcium crystals that is called as hydroxyapatite crystals. These are very small in size. When the acid attacks on the tooth, on the surface of enamel, what happens? This due to the small size of these crystals, acid is easily get penetrated into the enamel, thus causing the dental caries. Now when the fluoride comes in contact with this calcium hydroxyapatite crystals, it makes fluoroapatite crystals. Now the size of these crystals become larger, thus they prevent the entry of acid into the enamel, thus increases the enamel resistance and reduces the enamel solubility. It forms hydroxyapatite crystal, and when it comes in with the contact with the fluoride, it forms fluoroapatite crystals. Next is increased rate of post-eruptive maturation. Two words are very important here: post-eruptive maturation and demineralization. Deposition of minerals in hypomineralized area. Hypo means small or less. Hypomineralized area, when we deposit minerals in there, it is called as post-eruptive maturation. Whereas deposition of mineral in decalcified area, it is called as demineralization. So fluoride plays a very important role in deposition of minerals in hypomineralized areas, thus preventing the dental caries. Then there is remineralization of incipient lesion. Again, fluoride play a critical role in remineralization of incipient carie lesion. What it does, again, it will, when the fluoride comes in contact with this remineralized area, the crystals which are present inside them will become larger, thus remineralize them and further prevents dental caries. Then there is fifth one is interference with the microorganism. Two important things: when the fluoride concentration is higher, it will become bacteriolytic. That means it will kills the bacteria. When the fluoride is in low concentration, it will prevent, that is bacteriostatic. It will halt the growth of bacteria. That's why fluoride is very important and play a major role in inhibiting the dental caries through interference with the microorganism. And the last one is modification of tooth morphology. Yes, against the when the cusp, if you ingest a fluoride at a very early stage of your life, the development of cusp and the tooth morphology there are less fissures, and there will be more size of the cusp. Just thus, if you ingest a fluoride during your early ages, it will alter the tooth morphology, thus preventing it from having a dental caries. So these five mechanisms are really very important. Important short note, and in fact for Vivo also it's very important topic. Why do we need the learn to know about the toxicity? Fluoride is considered as a double-edged sword. It helps also, it hinders also. Now, previously the fluoride was used as a pesticides, but its beneficial effects in prevention of dental caries led to the more frequent use of fluorides. But fluoride, though it is useful, but if it's taken in an extra concentration or more concentration, it also affects the body. Now, the classification of fluoride toxicity, they are of two types. First is acute fluoride toxicity, and second is chronic fluoride toxicity. These are the few effects of concentration or dose of fluoride. If it's taken in 2 ppm, it does injury to the vegetation. 1 ppm, it reduces the dental caries. If it's taken in higher proportion, does the mottling of enamels. If it's more taken in 8 to 10 ppm, it will cause skeletal fluorosis. There is osteoclerosis. 20 to 80 milligram, if it's taken, it causes crippling fluorosis. If 50 ppm, thyroid changes can be noticed. So these are the various concentration or dose of the fluorides. Some are useful also, some are harmful also for the human being. Now, the toxic effect of chronic excessive use of fluoride ingestion. Now, chronic use is that continuous taking of fluoride in low concentration for longer duration of time, whereas acute is suddenly high intake of fluoride concentration. And the dental fluorosis is more than 2 times optimal dose until the 5 years can cause harmful effects. Skeletal fluor is 10 to 25 milligram per day till 20 to 20 years. Same with the kidney damage. If you take excess amount of fluoride, if you ingest excess amount of fluoride for 6 to 12 months, it can cause you a kidney damage. Now these are the some doses. Certainly lethal dose is 32 to 64 milligram of fluoride per kg body weight, whereas the safely tolerated dose is 1/4 of the CLD. That's certainly tolerated dose 8 to 16 milligram fluoride per kg body weight. Now coming to your acute toxicity, as I mentioned earlier, consumption of excess amount of fluoride in a shorter time will lead to acute toxicity. It is certain to say right, but based on the various observation, 10 to 5 to 10 gram of sodium fluoride would certainly be fatal for a person. Exactly 5 to 10 gram of sodium fluoride can be fatal for a person weighing 70 kg. Gross rather than adults should be 30 to 64 milligram per fluoride per kg body weight. Now, use of dentrifices in the one dentrifices packet, there is almost 1000 ppm of fluoride, may even up to 150 or 1500 ppm. In Europe, due to aesthetic concern, it has been used in high concentration. So while brushing the tooth, you have to take a required amount of dentrifices, and while brushing for the children, they should be given small amount, as the dentrifices contain high amount of fluorides. The fluoride mouth rinse are available in USA. Bottles containing 18 ounces or 532 ml of fluoride. This is the 2.5 times safety or safety tolerated dose, you can say. The one with 0.25 milligram doesn't pose to be a lethal hazard in USA. Characteristics of toxicity: it can affect you gastrointestinally, it can affect you neurologically, it can affect though the main function, it will, the acute form of this will block the cellular metabolism, it can lead to death also. Non-specific symptoms include excessive salivation, tearing, mucosal tear, well, myopathical signs, cardiac arrhythmias, coma, and finally can lead, though I mentioned earlier, it block the cellular metabolism and can finally lead to the death. Chronic toxicity, again the consumption of fluoride for longer duration, small amount of fluoride for longer duration, uh, or long-term ingestion of fluoride. Dental fluorosis is an endemic disease in geographic areas where the contents of fluoride ion in drinking water is more than 2 ppm. Yeah, 2 ppm will always called dental fluorosis or mottling of enamel. Enamel fluorosis is a developmental phenomenon due to excessive fluoride ingestion during amelogenesis. During the tooth formation, during amelogenesis, if there is excess consumption of fluoride, it will lead to the mottling of enamel or fluorosis. In Deans has given the classification for the Dean's fluorosis index in 1942. You can see the white, or on the first diagram, white patch is present there. This is the stage 1 or stage 2 of your fluorosis. Second diagram, severe staining, near pitting and severe staining. This all usually occurs during the amelogenesis of teeth. As a result, there is lusterless, opaque white patches, mottled enamel, serrated, hyperplastic areas can be easily marked on the tooth. Dental fluorosis in India, there are few states like Andhra Pradesh, Gujarat, Haryana, Madhya Pradesh, and Rajasthan are mostly affected with the fluorosis because there is high concentration of fluoride in their drinking water. Features includes severe back pain, back joints. If it's taken in excess amount, that is more than 5 to 6 mm, it will cause back joint problems, stiffness of joint, outward bending of legs, and it is also called as Knockney syndrome. You can see in the diagram the person affected with the skeletal tissues due to consumption of excess amount of fluoride. Other toxic effect can be results in the fetus during the pregnancy. Blood vessels are damaged. Skeletal fluorosis, if it's taken 20 to 80 milligram per day fluoride for 10 to it will cause you Knockney syndrome or skeletal fluorosis. There is neurological manifestations also. Treatment for vomiting should be induced as soon as the symptoms appears. 1% calcium chloride or calcium gluconate in the form of milk can be given. Hospital emergence is very much necessary as soon as the acute toxicity or chronic toxicity is affected. Vomiting should be induced if the victim has no gag reflex. Should not be induced if the victim is having any gag reflex while he is unconscious. The cupped endotracheal tube can be inserted and the vomiting can be induced. In hospital, immediate care should be taken. Cardiovascular circulation can be done, blood samples can be collected, plasma fluoride concentration can be known. Fluid replacement theory, as the vomiting is induced excess, there is loss of water. Fluid replacement therapy can be done. Intravenous fluid should be in the form of sodium bicarbonate or lactate ringers to minimize the degree of acidosis. ECG monitoring, intermittent calcium replacement, glucose administration, O2 therapy, or hemodialysis can be done. Recommendation, as I have mentioned earlier, supervision, parental supervision should be done on the children for mouth rinsing and while brushing. Use a small amount of toothpaste. Use of products with lower fluoride levels. Teaching children not to swallow the toothpaste, and strict adherence to the recommendation by the professional dentist should recommend the use of fluoride to limit in a limited so that it will not cause dental fluorosis. Recommendation: below 4 years, toothpaste is not required. 4 to 6 years, small amount of toothpaste twice a daily can be done. 6 to 10 years, again a small amount. A pea-sized shape toothpaste can be used for brushing. About 10 year brushing thrice daily with fluoride toothpaste will help them. Today we will be discussing systemic fluorides. In previous class, we have discussed the introduction and mechanism of fluorides. Now we will be covering systemic fluorides. Systemic fluorides are the fluorides which are given in low concentration but they act for a longer duration of time as compared to our topical fluorides. These are the topical fluorides are given at the longer concentration, higher concentration, but it acts for shorter duration of time. Systemic fluorides, it is given at low concentration, but it will act on for longer duration of time. Coming to our classification, this systemic fluoride can be given through water fluoridation, salt fluoridation, milk fluoridation, dietary supplements, or fluoride tablets. Coming to the first, we'll discuss that is community water fluoridation. Definition: it is an upward adjustment of the concentration of fluoride in a public water supply in such a way that the concentration of the fluoride ion in the water may be consistently maintained at 1 part per million by weight to prevent the dental caries with minimum possibility of causing dental fluorosis. Again, the definition explains that you have to maintain 1 ppm, that is 1 part per million concentration of fluoride in a water, just to so that the dental caries can be prevented and dental fluorosis may not happen. Various studies have been done that 1 ppm of fluoride was considered optimal in Jan 45, 1945, Grand Rapids. Here, the Grand Rapids and Muskegon study was done. Grand Rapids was case and Muskegon was control. Around 6.5 years, this concentration of 1 ppm of fluoride were added in a Grand Rapids water, and after that, same children were selected, but after 6.5 years, there was tremendous decrease in caries as compared to the children who were drinking from the Muskegon because they were fluoridation. That time, the fluoridation wasn't done. Other studies, Brantford, Santia studies, Evanston Oak studies were found same results, that the addition of fluoride when is done on their drinking water, there was tremendous decrease in the dental caries. Optimal fluoride concentration and climatic condition. U.S. government has given this that as soon as your temperature rises, there should be decrease of your fluoride concentration. This estimation of fluoride concentration is given by Gallagher's formula, which states that ppm, that is fluoride ppm, is equal to 0.34 divided by E, where E is 0.038 plus 0.0062 into temperature in Fahrenheit. When calculated, the results shown that if it is less than 18.3 degree, then the fluoride concentration is 1.1 to 1.3. As you can see, the temperature rises, the concentration of fluoride is decreasing. The optimal fluoride concentration, now it has said that it should be 0.5 to 1.0 ppm, which causes around 60 to 70% reduction in dental caries. Whereas the method of concentration estimation in the drinking water, you can see that 500 ml of collected in dry polythene container, 2 cubic centimeter of HCl is added. Why HCl is added? To inhibit the microbial growth and enzymatic process. It is stored at 4 degrees Celsius, and the concentration can be obtained through fluoride electrode coupled method with standard pH and through Scott-Sanchez method. With fluoride electrode method, it is simple, accurate, and the materials are easily available. These are Orion 961 microprocessor, ion analyzer, and Orion 407 are used. Scott-Sanchez method, though it is addition and the color changes have been recorded, the addition of red zirconium is added to the fluoride. Then in the last, the fluoride level is in the test material is determined by comparing the color with the standards. The limitation of community water fluoridation, that it is as it should have a centralized water supply, whereas in developing countries there is lacking. In rural areas there is no addition of this fluoridation in their drinking waters. Another, there is cost highly expensive. That's why there is limitation of this community water fluoridation. There are some equipments and chemicals used for water fluoridation. The equipments used as saturator system, dry feeder system, solution feeder system. Chemical used can be fluorospar, sodium silicofluoride, ammonium silicofluorides. Saturator system, it works on the 4% principle of addition of sodium fluoride and injected into concentration at the water on the factors limiting. As soon as the water becomes hard, or in a hard water over 75, need to clean and gravel bed used for filtration. And recommended suitable for small towns. Yeah, this saturated system is recommended for small town. a total requirement of less than 3.8 million liters per day. Coming to our dry filter system, this principle works on the sodium fluoride and sodium silicofluoride powder was introduced into the dissolving basin with the aid of automatic mechanism, factors limiting the need of care in the handling fluoride, and recommended in the medium-sized town where more than 3.8 million water is required. These are the few Venturi fluoridated diagrammatic representation. You can see how can it has been fluoridated. Technical consideration in water maintenance and control, as I have maintained, is expensive. In developing countries, it is lacking in water fluoridation, control of water, whereas we need a centralized pipe system also, monitoring. Then monitoring is also done, early checkup, calorimetric chemical testing, and continuous electronic measuring has to be done. This is the anti-fluoride lobby. Coming to our school fluoridation plays a major role in reduction of dental caries among the children who are in the school, and especially used where the children where the prevalence of dental caries is very high. Recommended concentration can be added 4.5 to 6.3 ppm, because children below 6 years, if they consume this much of fluoride, it will be beneficial for them, as it won't they won't have any dental caries in future. By adding this, there is 40 to 50% reduction in DMFT, decayed missing field teeth scores. Next is milk fluoridation. The milk fluoridation process was started by Ziegler. He was a pediatrician. He found that the nutritive value of the milk can be increased by addition of fluorides. Moreover, it will also help in not developing dental caries. So, this milk fluoridation concept has been followed till date. The addition of fluoride is done in the milk, whether it is packet milk or bottle milk. The fluoridation is done. Salt fluoridation, it is done in Switzerland first time in 1959 by addition. Advantage, it is safe, it is daily consumed, and it is easily available, whereas it has low cost also. And disadvantage, there is no control over the individual consumption. Exactly. In some parts there is high consumption of salt, in some parts there is less consumption. So this is the disadvantage of salt fluoridation. There are fluoride tablets and vitamins which can be easily available. Dentist can prescribe this fluoride tablets and fluoride dosages, so that it is easily available, and it is a home remedy and a preventive procedure also, so that we can prevent dental caries. There are fluoride drops which are easily available in the markets. Just you have to apply drops of the fluoride, so can the dental caries can be prevented. Now coming to our next, that is defluoridation. Again, it is a short note and can be asked as your long note. Defluoridation is the downward adjustment, whereas the water fluoridation was the upward adjustment of concentration of fluoride, whereas defluoridation is downward adjustment of fluoride concentration in a public water supply in such a way that the fluoride ion in the drinking water may be constantly maintained at a 1 part per million by weight to prevent the dental caries with minimum possibility of causing dental caries. In a simple way, there is downward adjustment in the process, or it is a process of removing excessive fluoride naturally or naturally present in the water in order to prevent dental fluorosis or more severe disability. These are the few methods of defluoridation, but the most accepted method is and the most good method is Nargonda Technique. This Nargonda Technique was started in NEERI, that is National Engineering Environmental Research Institute, which is in Nagpur. This technique allows, if the water which is having a high concentration of fluoride, there we have to add an alum, and we have to continuously stir that alum in. Then the floccules forms. This floccules, as we kept it for a few hours so that it will settle down. Then the filtration is done with the help of Fuller's earth, and the Fuller's earth is easily available. And then the disinfection of the water is done, and it has been available for drinking. This end, with this, I will like to end my lecture.